So, with traditional cancer care, your physician will make a decision in terms of recommendation as far as the treatment based on the tumor subtype, and we'll talk a bit more about that during this session. But for metastatic breast cancer, the three major subtypes we think about are triple negative, HER2 positive, and hormone receptor or estrogen receptor positive. And so depending on the type of cancer somebody has, the standard treatment would be either hormonal therapy or chemotherapy, or perhaps some sort of HER2 therapy usually with chemotherapy. As far as a clinical trial, they really come in all shapes and sizes, and so it's hard to generalize and say this is what a trial treatment looks like. An example might be a standard treatment for hormone receptor positive breast cancer might be to use a standard hormone like letrozole, for example, which is an aromatase inhibitor. And in the trial, we might be combining that medicine with a new medicine, for example, a targeted treatment that might target a specific gene or pathway that we think might be going wrong in the cancer. And so on the trial, patients in that situation would receive a standard treatment, that is hormonal therapy, plus this additional treatment, a targeted treatment. Other examples might be that there could be a treatment that is being tested which is going to replace the standard treatment. So instead of getting standard treatment, standard chemotherapy, for example, one might be receiving an immunotherapy. And so that's obviously hot in the news these days, but there are studies in which patients will receive immunotherapy, and they might be paired with chemotherapy, but they might not be. They might just be the new treatment on its own.